on what that means in a medical setting and kind of what, we have a lot of workers' comp cases that actually see massage therapy. And so it's an interesting argument of what is necessary. One of my biggest concerns is that they're allowing gatherings of 50 or more a month before, or up to 50 a month before they're allowing the massage therapy. And, precautions can be taken in a one-on-one setting that can't be taken in a group of 50. So it's from a business owner's perspective and also a common sense perspective, I'm having a really hard time with it. But that's what it is. This is the first time in business that I have been closed for any period of time. I opened my practice in 2011 and basically had some really great opportunities right out of the gate. I started off with opening my practice. I had to do internship for my master's degree. So I did that with Paul Kalina at the university and learned a lot about concussions and things like that. And because of that, I was afforded some opportunities with the local high school. And so my office has actually provided sports medicine to Brewer High School for the last 8 years. And so I employ two certified athletic trainers here, a massage therapist and another chiropractor, as well as our office manager. And we're actually investigating physical therapy in the upcoming couple of years. It just kind of depends on a lot now. There's so much up in the air. So our decision to close, chiropractors are listed as essential healthcare providers. And the reason for that is because if all of our patients that seek management for pain and that kind of stuff were to flood the ER every time they had an issue, or the walk-in cares, that's going to take away from resources there. So by eliminating that source of relief and that source of managing problems, you are actually probably adding to the problem more so. And not to mention that the hospital and the walk-in cares are where people go when they're sick. So having more people flood to those places for reasons that are not relevant is detrimental to the whole thing. So our office decision to close came down to several reasons. A, my wife is pregnant. The other chiropractor's wife is pregnant, and they're both healthcare providers. The other chiropractor's wife is a physical therapist. My wife is a physician assistant, and she works in cardiothoracic surgery at Eastern Maine Medical Center. So thoracic meaning lung surgery in most cases. Right now, that's kind of a hot button issue because if they're doing surgery on somebody's lungs and it's a potential COVID patient, before there was testing available, they were in a risk situation. So a lot of chaos, but I decided that, if a month ago, we didn't have a lot of information. We didn't know what was going on. We didn't have access to the PPE for our office that we needed to effectively deliver care if we were going to for acute cases. And we felt that it was appropriate to give our society and ourselves time to figure out kind of where we stood in the mix, where we should be in terms of delivering care, and how the most appropriate way to do that is. So we elected to shut down completely for a month. It was the hardest decision I have ever made in my life. And it has been up there with the hardest months of my life, because running a business with no income is not easy. And trying to navigate, trying to navigate the whole mess of it. And I'm responsible for the livelihood of 5-6 families and 10 kids. So if I don't do something right, it falls back on me as a business owner, and on a intellectual level. Like, it's terrible. So trying to navigate these waters has been very challenging, and I've had to make some tough decisions, and I've had to make some decisions, and I've included my team in most of them. Ultimately the onus falls on me at the end of the day to make the decision that we ultimately make, but I have not made them without consulting everybody and including everybody in that process. We all just watched virtually the governor's conference and then had a meeting afterwards, which is why I was late to this. But and it was not an easy discussion to have because of the emotions that were going on with people, like, what are we going to do, that kind of thing. So I apologize for being a few minutes late, and I may not be on here for the full hour because of that.
No worries. It's only going to be a half hour anyways. So
Yeah,
these only go till 4:30. So you're good. So don't worry about it. And you do not have to apologize at all, because I can't even imagine the stress with all of this and everything. Now, of course, I know, because chiropractic, and this is why so many students are so interested in this field, is because it's so hands-on. Is doing anything telemedicine, is that even out of the question? Is that what really we made you close down completely everything, or can you do any type of consulting?
I have done consulting. I've had patients that have been in acute issues, and I've been, Zoom meetings and that, but most of what we do is so hands-on that's what people expect. So it is very, very challenging to convert that mentality. People call their chiropractor when they need that fix. It's not. I'm very rehab based, so I give a lot of exercises, but and I was able to do that with several people over the internet, but it still ultimately came down to it was very challenging, and we actually opted as an office to try not to do that because we partially didn't want to cheapen our brand. We didn't want to dumb down what we do to a level that fit the circumstances. So do we all have to adapt? Yes. Are we going to have to continue to? Yes. It's tough. It's really tough. But and I can't really answer how we're going to move forward because we haven't fully had that discussion yet, because we had that decision, or the information that I was hoping to have yesterday was delivered about an hour ago. So I don't know if you're familiar with the PPP loan that the government has put out, the payroll protection program.
No, but I would love to hear more about it.
So payroll protection program is the forgivable loans for small businesses.
Oh, okay.
You've heard of that?
Yes.
Yeah. So
I don't know if Sean has or not, but
so the way I've structured my business is that everyone's an employee. So everybody gets a W-2, taxes are taken out. Some offices are not structured like that. Some offices are contractor based. Some offices are, there's just a lot of different setups. But because I did it that way, all of my employees were protected, and I was able to get a pretty substantial amount of forgivable loan because of paying my employees. And so I got a lot of crap over the years. Financial consultants and everything said, you could save money if you didn't have employees, if you had contractors. And so by deciding to pay those taxes and be a part of that, I was actually protected my employees. One way, and this is a very personal conversation, and I'm giving you a lot more information, but we undertook a major construction project at my business last year. We built out, I've got the most advanced sports science lab in New England attached to my office. And so that's another hot button issue, because we just finished it about 3 weeks before. We were all the momentum in the world, had an endorsement from the next Bruins goalie, and so no, just kidding. So it was it's, I don't know, it's definitely interesting how I don't know, just how different decisions over the last 10 years have affected the way that this is all playing out. So
Absolutely. And I think this is really valuable information because, you know, a lot of students, especially if they want to do something in more PT, OT, chiropractic, you know, they want to have their own practice. And it's important to know that it's not just about you building yourself as a really strong future chiropractor, but also as a business person. And, you know, and that's a whole other, you know, component of this entire field. So you did mention a couple of times when you were kind of talking about your brand and about the different components that are in your practice. I would love to kind of now have you talk about just your experience at UMaine as a pre-health student, your experience at Logan, because I know Sean, that's definitely one of the schools that he's been looking at, and really how did Logan, or just how did your experiences prepare you to have, you know, such a really well-known chiropractic office in, you know, the state of Maine and in New England?
Yeah, I mean, I've been so I really enjoyed my time at UMaine. I wasn't involved in athletics or anything like that. I started out in the KPE field, which or the KPE degree. They actually didn't offer athletic training as a degree at that point. So I love sports medicine. I wanted to go into sports medicine. And one of my biggest regrets, I actually switched my degree to biology at the advice of somebody, I can't remember who, but if the one piece of advice I have for students at this point is get a degree, an undergraduate degree that is also like something that you can get licensed in. So if you want to go into healthcare, study nursing or athletic training or something like that, even if you have aspirations further, you want to be able to go out and get a job in something relevant to what you're doing right out of school. You know, you know, biology is a great degree. I'm not knocking it. However, if you want to work at Jackson Lab with mice, that's what you want to do. But if you want to be in healthcare and directly interacting with patients, you want to be in something that you can have that interaction. So if I could go back and do it again, I would have gotten my degree in athletic training. But not what is your degree in, if you don't mind me asking?
Kinesiology, so exercise science.
Did I lose you?
Oh, can you hear me?
Okay.
My audio's going.
Yep. I mean that's good too.
I heard you.
Get whatever certifications you can as soon as you can. Their certifications are cheaper a lot of times as a student, and sitting for that type of stuff, you know, certified strength and conditioning coach, personal trainer, you know, basically anything you can get your hands on while you're in school is worth your time. And then once you're in chiropractic school, I loved Logan. St. Louis is a phenomenal city, and the people out there are great. I've heard really good things about Parker Chiropractic College in Dallas, Texas. I've heard really good things about New York College in is it Rochester? Yeah,
I believe so.
You know, and I know UMaine has a partnership with Logan, which I would not do anything differently with my education. I felt like I came out prepared. And I think one of the great things about this profession, you know, PT, chiropractic, you can be whatever you want to be. You know, I mean, I've got chiropractors that do pediatrics. I've got chiropractors that do, you know, like myself, that specialize in sports. In Maine, it's a little bit harder to just hit one niche. You kind of have to see everything, but focus in one. But ultimately, you know, you can write your own playbook basically. And that's what I've done. You know, my practice, when I walk into work, it's like, how did I get here? Because this is what I pictured 10 years ago, you know? And I lost you again, I think.
Oh, we can still hear you.
I think that's what's one of the most inviting things about this field, is that you really kind of get to sit in the driver's seat and really make the most out of it. Whatever that is for each individual.
Yeah. I think I'm going to be completely honest with you. Some of the things that I would caution you about is PT and chiropractic. You oftentimes don't see tuition reimbursement like you do in the PA and medical fields that you can get at a hospital. So, you know, that's something to keep in mind. Coming out with debt, you know, there's a burden no matter how good you are at what you do. So I think that's worth keeping in mind. and really, get a grasp on your finances. And, when you take out student loans, understand what it means. Don't just sign on the dotted line. Understand, what am I going to be paying 10 years from now? If, and that, I think that's really, really important for, somebody coming out. Ask chiropractors, and I think for a student, what can I expect to make out of school? I don't know the answer to that because I started out on my own, but I know that there are a lot of people that didn't do the way I did it, and they can tell you that. So, have you job shadowed?
Yeah, so I've been shadowing for the past 2 summers now.
Nice.
It's at a place it's in Dedham, Massachusetts, so it's like 20 minutes from my house. And then this upcoming summer, the doctor is basically hiring me as like an office assistant, so like helping people with like electrotherapy, ice pads, heating pads, kind of stuff like that, but a little bit more practical application instead of just a shadowing approach.
Okay.
I think that's great. Oh, are you still going to be able to do that with everything that's going on?
So that's the thing. I've touched base, and he said that his office is still open. This is a couple weeks ago. It's just been very much so slowed down. I'm pretty much going to reach back out soon and say, hey, I'm end of finals or next Friday for me. Here's when I can start.
Yeah, that's awesome.
Don't be surprised if you're not able to.
No, that's kind of what I'm expecting at this point.
Yeah.
However, I guess I would suggest maybe getting some experience with some other practices as well. I think because chiropractic is such a diverse field, there's a lot of different personalities. There's a lot of different styles, and I think having one person tell you this, and if they have a great experience, the next person might not, or they might have different things to add. And I think that what year are you?
I'm a junior right now, so going into my senior year.
Okay, so I mean, I don't know what next year brings, but maybe look at what opportunities there are to just try some different offices, and maybe not set up a whole semester long, shadow for a couple days, couple weeks, whatever, and get experience that way.
Mm-hmm.
And he's met Dr. Bruns at a previous Logan thing, and so and Dr. Bruns, I mean, he has specialty in acupuncture, and I think his wife is a massage therapist, so he kind of got to pick his brain a little bit, so he got to see that side of it. And Dr. Bruns is always super great with wanting to work with their students and everything. And so obviously again with what's
I've actually been I actually just sent him a message. Massage therapy until July, August. And I said, oh my goodness. And he goes, my wife is not going to be very happy.
I was just about to say,
yeah. So,
it's tough.
Oh yeah. Obviously the political conversation goes deep, and it's not something that we should get into today, but it is definitely an interesting time that I never thought I would. And you can't prepare for stuff like this. Like, it's just, when you own your own practice, I get questions and calls that I'm like, how did you even come up with this? How did this problem evolve from whatever it started as? Because you just can't anticipate everything that's going to happen, and you have to be flexible. And, it's, there are days when I love it, and there are days when I want to rip my hair out, There are days when I get to go to the university. I go to the university a couple days a week, and it's like, it's fun. Who want to get being
so
there.
So are you able to see, because I know that the athletic department was staying open for student athletes who have had recurring injuries or anything like that. And so is that what you're doing? You're able to go to campus and work with those students?
Up until this point, I haven't. I mean, there are very few things that I would consider a chiropractic, like life-threatening emergency. So, you know, I have done some telemedicine with some people, and you know, done like just consulting type work that way. Because of our sports medicine background, and our like sports science background, we do a lot with motion analysis, and you know, kind of giving people, okay, this little tweak can help you get, you know, that last 1%, you know, things like that. So, you know, we've got our facility, we've got about an 800 square foot space that has a batting cage that you push a button and the batting cage drops down from the ceiling. So we could have a hockey player shoot a puck with our motion sensors on, and it does motion capture. So,
so cool.
And then we translate a lot of that back to, if you don't mind me sharing my screen, I'll show you kind of what we do.
Totally, go for it. I will give you, I gave you access, because that sounds so cool.
Yeah, it sounds really interesting.
Yeah, so we can, let me find the video. Okay, so I'm not on that computer, so I don't have any of our actual material, but I can share.
This is a 42-year-old male.
All right, so I'm gonna pull that out, and then I've got a share screen, and there we go, YouTube share. So can you see that?
Yes.
Okay, so you see the motion analysis screen?
Yep.
Okay, so basically,
high-level runner.
How do I shut off the sound on this video?
If you mute it when you hit play, then you should be good.
Yep. Okay, so basically, we have these same sensors, and the video of the person running, you can actually draw from these. See these white dots that are flashing there?
Yep.
On his heels.
Yep.
Yeah. So you can actually one of the most mice that are moving is the person demonstrating, but so we can set the video to actually draw tracers from these colored dots on a video. And then this avatar down here in the lower right hand corner, the skeleton that you're seeing, that is a rendering from motion sensors. So basically it creates this avatar, and you can actually see how the pelvis shifts really aggressively when he lands on his left leg right here. Watch.
Yeah.
See that shift?
Is that normal?
That is abnormal. That's
okay.
a form of
painful.
What's called Trendelenburg gait. So it indicates weakness in that left hip. And so we would, like, for example, if a runner showed up and was asking us, saying, you know, what can I do to improve? First thing we'd look at is that, and maybe ankle mobility. From this, we can actually run reports that show us exactly how much range of motion somebody has in their hip when they're running at full speed. So you can't, no matter how good you are at gait analysis, you can't see that unless you have some equipment to kind of pick it up. And you can't see it in a way that's reproducible, because range of motion is you know, once you get that number, then you can do it again and compare the numbers. But just looking at it is guesswork. You know, I can see that hip drop on the video, but I can't actually tell you how much it is until I run a report. So the value in this software is actually the reporting. The other thing that is actually relevant here is this right here actually gives us EMG. So we have an additional set of sensors that we put onto the person, and it actually tells us what the muscles are doing in real time. So let's say we find a motion issue like I showed you with the hip, then we put the EMG on and we see, okay, we can validate that that muscle is not firing when it's supposed. So we're actually working on a study with Ryan Taylor and the university this fall to look at the women's basketball team and the men's basketball team to see if there are any markers. And then there's a lot of people that are trying to do injury prediction, and I think that that's been overplayed a little bit, because great, you predicted this person going to have an injury, I don't know how. Maybe that'll be usable about 50 years from now when you can actually but in the real time, if you can find markers that are also showing up in people with arthritis when they're older, and in markers in people that have had ACL injuries, that you also see weakness in the quad, if you can identify that in somebody pre-season and say, hey, this person has weakness in their right quad, that needs to be addressed now rather than after an injury occurs. So that's kind of where we're going with everything that we're doing. And then lastly, I want to show you, so this is the video that actually made me buy this software.
It's a great video. I can see why.
Well, this one right here, actually. I'm going to play the audio.
Technology people ask me, well, here's an electromyography with neuroaxon equipment.
Can you hear that?
Squat.
Yeah.
Myself.
Yep.
Left glute not firing like my right glute. My left hip consequently has been hurting. And it's very simple. The muscles aren't firing. They're not protecting. They're not absorbing shock. I'm losing propulsion in my left leg. A plethora of things could occur. If we don't diagnose, how can we prescribe and fix?
Wow.
So
Yeah, by those metrics, you can really see the imbalances.
yeah, right. And so, I mean, I don't know. You can say a lot of things, but if that's not diagnostic, then I don't know what is. And you know, we part of our sports science lab is less about trying to be the solution for everybody, but trying to just give them information that they can is a starting point. And another thing that I think a lot of healthcare providers do incorrectly, and I'm not saying anybody specifically or anything, but people overload their patients. They try to give them 400 different things to do. What we've done with this, we've got this high tech, you know, this software is the same stuff they use at the Olympic Training Center. It's not just something I went and bought off the street. It's something that I researched very heavily and made an educated decision on purchasing. But we put together a report, and that report has tons of information on it. But then we give them 3 things, and we say, these are your 3 priorities in order. If you don't get this right, then this isn't going to work right. If you don't get this right, then this isn't going to work right. So start them off with priorities, simplify it so that it's not overcomplicated, and then, you know, your patient's going to, we've done a lot for people that have been around laps of seeing different providers, getting all sorts of different advice when, you know, you can just look and see that information. So I know awesome. I think I went a few minutes over, but
no, and that's totally fine. I think that was great. Just before we do end the session, because I know you are very busy and have all kinds of fun things to figure out. Sean, do you have any questions specifically for Dr. Healy before we end our session today?
So I believe I heard that you started your own practice in 2011. So did you, straight from graduating from Logan, did you go immediately into starting out on your own, kind of took that leap forwards, or did you do any other like professional experience post-graduation to get to that point, or did you kind of just go for it?
So I had worked at a clinic as part of my schooling for a while, and I did look for jobs, but in Bangor, Maine, the jobs there weren't a ton of them, and I kind of I didn't find one that fit me the way that I wanted it to. So I ended up making a decision that, you know, I'm very particular. I like things a certain way. I like to I like to be the one giving the answers, not the one asking for permission for things. And so it just was a good fit for me to get started. And I lucked out. Like, not everybody has the opportunity to work with a Division I program. You know, I've treated so I can't even count. And it's cool because I've had the opportunity to work with these guys, and I still get, like, there's guys that got drafted that, you know, still reach out to me every once in a while and ask me advice.
Really?
Somebody one time, he told me, he goes, "Hey, I was at a camp with Deshaun Watson." You know who Deshaun Watson is?
Yeah.
Yes.
Yeah. He goes, his hip was bothering him, so I gave him the exercises you gave me. The end of the week, he told me it was feeling a lot better.
No way.
Oh my gosh! So you could say that you inadvertently you treated Deshaun Watson. I would take
I don't
that to
think
my
so,
grave.
but it was.
I would say it.
I will say that it's very enjoyable to get that kind of feedback, and working with athletes to me is so rewarding because they just, when you can help them with something that maybe they've been struggling with, or maybe give them a little bit different perspective that they haven't had before, it's mind-blowing for them. And some of these kids are at the top 1%, you know what I mean? And so you're trying to get them that 1% of 1%, and they think that is a game changer. Whereas, some people, you're dealing with people that are trying to get the top 50% when you're in day-to-day practice. So there's a big difference between, elite athletes that are trying to refine themselves and, day-to-day population that are broken and need to be repaired. And sometimes athletes are broken and need to be repaired, but it's definitely a rewarding environment to work in. I guess the one biggest challenge I would say is that they want things yesterday. And, if you're not delivering or at least explaining to them why things are the way they are very effectively, you're going to have problems with that population.
Definitely.
But if you don't mind, can I share one last thing with you guys?
Absolutely.
Before we go.
Of course.
All right. So let's see, photos here. So I'll show you, actually, let me share, and then this. So this is, can you see that?
Yep.
That's our sports science lab here in Brewer. So
wow.
That batting cage drops down, uses a winch to raise and lower. And the name of if you want to look it up, you can do some research on it, but the Maine Athletic Health Center, we focus a lot on gait analysis. I put a lot of stock in gait analysis. I think it's really important. But we then apply the concepts of the gait and where we found deficiencies to sport-specific movements. So hitting a golf ball, hitting a baseball, whatever. And we've had some really, really cool outcomes and found some things that, kids that have had 3 MRIs didn't know. And so looking at functional movements, we can, break it down. We've actually made a pitch to several schools to do baseline testing with their athletes from a biomechanical standpoint. And we're probably going to be doing that with a lot of the University of Maine kids this fall. So.
Oh, that's awesome.
Yeah. So
not just with their concussions, so they're also getting it with everything else too. Yes.
And I think that's where the idea kind of stemmed from, is that, injuries can be not necessarily prevented, but there are definitely markers that indicate this is a risk factor. And so, whether or not you're preventing them directly, if you can provide strength to a muscle that's not as strong as the other side or is asymmetrical, you're not doing the kid any harm. So.
Right.
Yeah. So anyway, if you guys, and Samantha, if you ever want to bring your classes down here and see this, it's one of a kind.
Yeah, we'll probably take advantage of that since I'll be teaching 2 classes in the future. So great. I will make note of that. So thank you. Sean, do you have any other questions for Dr. Healy before we officially wrap it up?
So you said you normally work with athletes for the most part. Are those the largest demographic that you work with?
I would say my reputation around here is pretty much sports medicine. I get a lot of orthopedic issues. That's how our practice is built. Musculoskeletal, rehab based. I give home exercises to pretty much every patient that comes through the door. So, you're not leaving here without instructions on what to do.
A little bit of homework.
I can't tell you the number of consults that I've done during the COVID-19 with just friends and people who are struggling with things on, hey, what should I do to stretch this or that? And, it's, just trying to help people out at this point. But yeah, I would say that's our largest demographic. But I still see, I've got my oldest patient is a 90-year-old man or 92-year-old man, and my youngest patient was probably about 3 weeks old.
Wow.
I actually did treat a one week old, but it was a friend's kid. So, and when I say treating a 1 week old, you're just I'm looking for imbalances, and it's not like, snapping, cracking, stuff like that. It's basically like gentle pressures, checking to see muscle imbalances. I got a kid on the way. I'm going to check those things on the kid. And I would say
Instability.
60-70% of the time, I don't actually provide any adjustment. It's just an evaluation to make sure there's nothing majorly abnormal right out of the gate, and you can investigate those things in different ways, but become a very good diagnostician, because there's always things that walk through your door that you might not be a chiropractic issue. And if you don't know how to rule in or rule out whether or not, sometimes knowing when not to adjust is not to treat is just as important as knowing when to treat.
That's some really great advice. Thank you.
Yeah, no problem.
Anything else, Sean?
Well, I could keep going, but I don't want to take up too much of your time. So
yeah, you're fine. If you have a legitimate question, go for it.
Yeah, go for it.
Can you put me on this? I didn't really have a third question lined up, so.
Right. I guess I'll give you one other piece of advice is don't ever chase pain.
Chase the symptoms, or not the symptoms, the root cause of it.
Yes, follow when you're assessing somebody, look for where there's dysfunction. Don't look for where things are failing, not where it hurts, because 9 times out of 10, where it hurts is a symptom of the cause.
Yeah. And it can be diffuse pain as well.
Correct. And that goes for anything. If you end up in chiropractic, if you end up as a medical doctor, just going after the pain is it's like putting a piece of duct tape on the bumper of your car when it's falling off.
Yeah. No, exactly.
Basically, when I have a headache, it's my boyfriend because he's the cause, and that's why I'm getting the pain. Okay, perfect. And you know him, Kevin Ritz. He's the cause of all my headaches.
Yeah.
I'm just kidding. But anyways, well, do you have any other? Sean, do you have any questions, or Dr. Healy, if there's any other?
You're welcome. You're welcome to reach out to me. Sam has my email address. If you have any more questions, don't hesitate. I've got some time on my hands. I don't know exactly what my schedule is going to be like over the next month, but don't hesitate. I'm happy to help.
Definitely.
Yeah, Sean, if that would make more sense, I can definitely just share his email with you.
Yeah, that'd be awesome. Thank you so much.
Cool. Well, Dr. Healy, thank you so much for taking the time to talk with us and to share your insight and everything. I think this was extremely valuable and very interesting, so I really do appreciate it. Sean, thank you for joining us, and I hope you guys have a great rest of your day.
You too.
Hang in there. It will get better, I promise.
Oh, I'm sure it will. It always does. See ya.
Okay, bye.